Hey, I'm making a quick video response. Um, I look terrible, first off. But, whatever, who cares? I'm pregnant! I am gonna be 19 weeks tomorrow, and, this is my third pregnancy. My name is Emma. Um, but I just wanted to do a quick video response on, your why we went with the midwife video. Um, and I totally agree with all of those reasons. And I guess I just kind of wanted to throw my piece in there. I, on the other hand, am going with an OB, and this is my third time delivering with the same doctor. And like I said, I definitely agree with all of the things that you were saying. About the 5 minute long visits and being treated like a number and them kind of pushing their opinions or how they think that you should have your baby on you or whatever. um, but I think that if you're a first time mom and you know that you really want to stay away from that kind of treatment or whatever, then it would probably be good to go with a midwife, especially if you could. Like, I probably would be with a midwife, would have been with all of my two previous pregnancies and this one. But unfortunately, I have a heart condition and it's crappy. Whatever. I personally think that I would be fine having a home birth or whatever, but you can never be too safe. Which brings me to my other point, that being another reason why it's not just the heart condition that I have. It's called hypertrophic cardiomyopathy, if you're interested. But that's not the only reason why I chose to go with an OB or whatever. And my reason was that I like the idea of having a hospital birth because there is that 1 in 2,000 chance or whatever that something could go wrong. Ella, please go sit down. Remember, I told you not to interrupt. But there's that chance that something could go wrong with me or with the baby, and the hospital is by far the best place to be if something were to happen. Chances are they would not happen, but all I know is that I don't need that for myself. I don't need the like nice surroundings and all that kind of stuff. I don't know what I'm trying to say without sounding like I'm bashing home birth or something. Because I do think that home birth is an awesome thing and should be done more often. But for me, it's just that extra assurance, and I'm comfortable in a hospital doing that in a hospital, having a baby in the hospital. Um, what else is I gonna say? Oh, as far as being treated like a number, yeah, that sucks. But at the same time, the experiences that I have with pregnancy don't dwell in my appointments. Pregnancy is very straightforward, to the point. You're pregnant, you treat your body well, and you check and make sure everything's good. you know I'm actually with my last two pregnancies with this OB. His name is Dr. Denison at Doylestown Hospital, and he's very good doctor. I'd put all my trust into him, and and we don't have like this like relationship. We're just in fact, if I saw him on the street, he probably wouldn't know my name, you know uh, and that's okay with me. What was I saying? Oh, but with my past two pregnancies, he has tried to sway me to do things his way. as far as the birth process goes. When I was pregnant the last time, I came right up to my due date. In fact, it was what was I? A week? Yeah, it was a week after my due date. Um, and the day that so I guess I was like a week overdue. But I had my child the day that they were going to induce me. Um, and I say that they were going to induce me. Little did they know I wasn't going to show up. And I told them that. It was actually, it's kind of a funny story because um, at that last appointment, my doctor said, this is the date we're going to induce you because complications can arise and all this stuff. And I said, well, listen, how about this? I'm not going to get induced unless all of the tests that I'm going to have you do come up, with concern. Um, and then I came up to like the day that I was going to be induced. They called me and they said, I just wanted to call and let you know that your appointment is this day and this time. And I was like, well, thank you very much for, making the appointment for me, but I'm not interested. It was just really funny because they were that pushy. They made the appointment for me. Um, but I think having been experienced or whatever, I know that it's not necessary to induce labor, like a week after your due date, unless something is really of concern. I think that it's really important to get those tests to make sure everything's okay. But otherwise your body will do it for you. It's just such a natural process, whatever. So I think that coming from somebody who has only had hospital births with a doctor, I think that this is my daughter in the background. Say hi, Ella.
Hi.
I think that hospital births are okay as long as you understand that they are going to push you to do certain things. And I think that hospital births are okay as long as you are educated on what is okay and what is not okay, as far as birth goes. And in the beginning, when I had her, that was my first pregnancy, he did the same thing. It was a week before my due date, and he said, this is the day that we're going to schedule your induction. And it was 2 days before my due date. It was just like, what? And I said, well, I'm really not interested. And then he started pulling the whole, your baby could die thing, like, low amniotic fluid and like stress in the womb and all this kind of stuff. Um, and that was just him being, treating it as a business of being born. You know what I mean? Like that whole deal. And I get that, and that's his job. Like, babies are gonna come out healthy, and whatever. So I don't hold it against him. I just think that I guess I strayed. What I was gonna say is hospital births are good as long as you yourself are educated and that you don't get walked on by doctors. But if you're not educated, it is very easy to get walked on by doctors and nurses because they tell you what they think you should do. And then when you are saying you want to do something, Ella, Ruth Ann, get down, please. When it's not what they want you to do, they start scaring you into it, and then you're manipulated, and that's not fair. So as long as you're educated, I think it's okay. But if you can, go with a midwife because they will embrace your pregnancy as you want it to be embraced because it is such an awesome thing. But don't be let down completely if you have to do a hospital birth. I'm not talking to you, I'm talking to everybody, because it can turn out okay. That's all. Thanks for listening. Bye.